Hello, thank you for tuning in to Givens Facial Plastic Surgery. This is Dr. Givens. I am a facial plastic surgeon in the Westlake Hills region of Austin, Texas. I am excited for you to join me today as I talk to you a little bit about a product that I am loving, and I'm so happy if I have added it to my practice. So a little bit about me first. I am a native of Louisiana, from Houma actually, but I'm a diehard LSU fan. I went to medical school and did my residency training there. And then I did my cosmetic and reconstructive fellowship in Indianapolis with the world-renowned Dr. Stephen Perkins. And now I've settled in Austin because it's both an amazing city and a great area to set up for practice. So today I want to talk to you about kind of a new product on the market that some people have been using, but it's new for both patients and physicians to learn about. But the product's called Exosomes, which is a bit of a strange word, but it's magical, it's wonderful, and I'm so happy I've added it to my practice. So first of all, there are different brands of Exosomes, but the brand that I have chosen to use and really like is called Direct Biologics, which you can see right here. Oh, I'm sorry, wrong side. Right here, Direct Biologics, and their brand is called Exoflow. So a little bit about exosomes. Exosomes are basically microvesicles. They're not actual cells. They're much, much smaller than cells, and they do not contain any DNA of any kind, and they're extensively tested to make sure there are no contagious viruses or any other contagions that could be transmitted. So they're very, very safe. They're actually derivatives of mesenchymal stem cells from humans, and they basically work by injecting or infusing and then signaling to other cells to draw them to areas of inflammation and areas that need to be healed and rejuvenated. So it's a really, really cool product that works by cell targeting. But today I'm going to talk to you about just the Exosome Facial that I provide, or the Exosome Facial Rejuvenation Procedure as it may be called. There are a couple of key items that I'm going to go through with you, and then I'm going to take you to my procedure room so I can show you the actual treatment. So I had a patient that came in that really just wanted some overall rejuvenation of their face. They felt like they were having a little bit of sallowing. Their skin texture was a little uneven and rough, and they just wanted to have a little bit more of a radiant glow in appearance, and overall hydrated. So for that, when I do a facial restoration with Exosomes, I also use a microneedling pen. The only one I trust and use is called Skin Pen by Crown Aesthetics. It is FDA approved. It's very straightforward and easy to use, and I love it. I will never change. So in addition, let me go through a couple of things. So first of all, whenever I do a procedure on a patient for any facial restoration with Exosomes, I will numb them. So I will put my special prescription strength tetracaine lidocaine mixture all over their face for about 15 minutes. So that's usually an adequate time. And at the same time, I will take out my Exoflow packet from my freezer. The Exoflow comes frozen, and you need to store it in a freezer. You have to thaw it, obviously, before you inject or topically infuse it into the skin. In order to do that, it's pretty simple. You just need to take it out, either put it in your back pocket, roll it between your hands, or let it sit out. Letting it sit out just by itself may take a little bit longer, but all I need is about 10 or 15 minutes for it to thaw completely out and be ready to use. Once it's thawed, I will take my normal saline, which is bacteriostatic. If I'm using a 2 ml vial of Exoflow, which looks like this, comes in this packet. I will take this 2 mLs, and I will take 1 ml of the bacteriostatic sodium chloride or normal saline, and that's what I use to dilute it. You don't have to dilute it. You can dilute it more or less, but I found 1 ml for me is what works the best. I will draw both of these things up into my 3 cc syringe. I take off the needle top because if I am doing a microneedling procedure with Exosomes to be infused in, I just apply it topically at the end of the procedure. So once I've drawn that up, I put it to the side. I generally will wipe the patient's face off, then I take my alcohol pads and I clean everything off, and then we're ready to go. So a little bit about my microneedling pen. Like I said, I love this pen. Each cartridge, which is this, comes in one of these kits, and they're disposable, meaning they're used for one patient only. And it's preventative in that if you take the cap off take the cartridge off of the pen after use or before use and you try to put it back on, there's a self-locking mechanism, so it's very safe. It prevents any cross-contamination of any kind. Also, what's in the skin treatment kit is the Skin Fuse, I always call it Glide, so I have to look at it, the Skin Fuse Lift, which is the gel you will put on after you wipe the patient's face off with, after you wipe off the numbing medicine and after you alcohol swab the face to cleanse it. I then put the Skin Fuse on to help the microneedle glide a little bit more across, which is why I call it Glide instead of Lift. And then I will use my skin pen. Now, the other cool thing about each cartridge, they have a little dial that can turn, and this can turn during the procedure. You don't have to turn the pen off and turn it back on to change the depth, because there are different areas, like your forehead and chin are probably going to be at a different depth than your cheeks and your nose and your lips and your eyes. So it just really depends on the depth, but you want to get that erythema to appear in that little pinpoint bleeding for each area. So let's go through it again. Once I have drawn up my exosomes with the dilution, numbed the patient, cleansed the patient's face, put the Glide lift, put the lift on, I will then take my skin pen the whole face or microneedle the face, and then at the end I will take my 3cc syringe without the needle on it, and I will circumferentially go around and distribute the exosome product and gently rub it into the skin. It's a painless treatment if done correctly and properly and by a professional. You get great results, and I cannot recommend it enough. My patient that you're going to see now had the procedure done today and felt no pain. She was very, very happy at the end, and I just tell them the redness will continue to go down over the day. You really want to stay away from any of your retinoic acids or retinols. You just want to use a gentle cleanser. If you get the procedure done in the morning, you can use that cleanser at night. If you get it done in the afternoon, you can use the cleanser in the morning. Otherwise, keep the face dry, drink lots of water, no strenuous exercise or things that are going to cause a lot of sweating for at least 24 hours. You have just created thousands of little micro openings or micro pores in your skin, which will close over in about 24 hours, but you just don't want any ingredients that you don't intend to go into those pores to get in there before that 24-hour period. Once you have allowed appropriate time of the face to numb and then cleansed it with an alcohol pad, you can then proceed to step 1 of the Exosome Facial, which is application of the hydrogel. You can then proceed to step 2, which is the microneedling application along the entire face. I prefer to start in the forehead. I usually go at a depth of about 0.5, but in this patient I wasn't getting the even erythema and pinpoint bleeding that I like, so I upped it to 0.75, which worked well. I then will proceed circumferentially around the face. I choose to usually go onto the cheek and jawline area first, which you can see now. Most of the time I can go at about a 1 depth, although sometimes you need to increase or decrease depending on your patient. I then proceed downward towards the chin and upper lip region, which I generally use a 0.5 depth. Now, the upper lip is one of the most sensitive areas to microneedle, although with proper numbing, as you can see in this patient, there were no issues. When going along the nose, I choose to go at about a 0.75 depth, depending on the patient's skin and structure. And for the under eyes, I use a 0.25 to 0.5 depth of my microneedle. Again, you always want to have a diffuse or even erythema. Once you're satisfied with your microneedling application, you can then proceed to cleansing the face prior to exosome infusion. Here you can see I have my 2 ml of exosomes combined with 1 ml of normal saline, and I'm infusing along the entire face. So I hope you enjoyed this. I hope it was educational. If you have any questions at all, you can call my office to schedule an appointment or discuss more about this procedure at 737-787-8200. Also, my website is very detailed. It goes through a wealth of knowledge of all procedures and things that I offer. It is www.givensmd.com, just my last name with my credentials behind it, MD. Otherwise, if you have any other questions, I have both a Facebook page and an Instagram page, victoria.givens.md. You can always DM me, and I keep it pretty active so you can see a lot of before and afters or things that are going on. But always feel free, if you have any questions, I'll be there to answer them for you. Thanks for tuning in again. Until next time, bye.